we already said that it's the aortic notch, right? So this is my aortic arch. And then this one is what?
Descending.
Descending aorta. Very good. So we're going to go by order. So the first branch of the aortic arch is which one?
Brachiocephalic.
So this is going to be my brachiocephalic, right? Yes?
Yes.
Can I sit on the table?
Sure.
Thank you.
Okay. Then here we're going to have this next branch is going to be my
Left subclavian.
left.
Sorry.
Left.
Subclavian.
Left subclavian, very good. Our left subclavian. Now, don't forget that this left subclavian also is going to give 3 branches. Like here we see the internal mammary, but in the left side. Okay?
Right.
Okay.
Are they the same names for the left and the right?
Yes.
Okay.
Remember that we're going to have 2 sets, right? One for each arm. Okay. So then we continue our brachiocephalic, right? And it's going to give me branches. Which are the branches of the brachiocephalic, please?
The internal mammary.
No. Brachiocephalic.
Right subclavian. Right common carotid.
Very good.
And the left common carotid.
Okay. So I have here my right common carotid. You see it?
Yeah.
Remember, the point of reference is your trachea, right? And then here I see my left common carotid. Remember that they're parallel to that trachea, because they're the ones who provide blood supply to the brain, right? These carotid arteries.
So left and right common carotid.
Yeah. Remember, we're doing the left side of the kidney, not your left, it's the kidney.
Right.
Very good. Now we're going to see our next branch. You see how it's going towards the right side? So then this is telling me that this is going to be my right subclavian.
Yeah.
You see it? And it's called subclavian because it goes underneath the clavicle. Very good. So then the subclavian also is going to give me branches. What happened with the branch? Okay. The first branch that we're going to see here from this subclavian is going to be our internal mammary. You see it here? You see the small caliber vessel? My internal mammary. Then it's going to give me my, I'm waiting.
Vertebral.
The vertebral, you see it here. And then it's going to give me the,
Costocervical.
and this one got severed. Okay? Severed, this one. Now that's fine. It's not uncommon. Now, remember that we said that subclavian, this right subclavian, once it goes into the armpit, is called what?
Axillary.
Axillary. Very good. Now, the way that you know that you're in the armpit is that you're going to draw an imaginary line. See? You see it? This imaginary line, and then I know that I'm in the axillary artery. You see it? This is going to be my axillary. Now, remember like the analogy that I gave you about street names, right? What happens, this axillary, once it goes into the arm, we continue dissecting, right? It's the brachial, exactly. You just have to continue dissecting and separating it with the probe so you can see it better. So far, so good?
Where's the thyrocervical?
The thyrocervical usually gets cut off because these are very small caliber blood vessels.
Okay.
So just continue dissecting, and then also you're going to start dissecting a little bit of the lower arteries. I guess we could start doing it, right?
Yeah, let's do the little.
All right. So now, after the aorta goes into the abdomen, we call it what?
Abdominal aorta.
Abdominal aorta, which is the first branch of the abdominal aorta plate. I'm waiting. Look it up, please. Branches of the abdominal aorta.
Go down more.
Okay, I put it in. Yeah,
Celiac artery?
The celiac trunk. The celiac trunk is the first branch of that abdominal aorta.
The first branch?
So as we separate with our probe, we see here clearly our celiac trunk. You see it? Yeah. Now the celiac trunk is going to give me branches. Which are the branches of the celiac plane?
Hepatic artery, the gastric artery, and the
Splenic.
Very good.
We did that this week.
That main pink one, that's or red one, whatever you want to call it, that is the whole trunk.
Yeah, this is the celiac.
trunk.
The big one, or the biggest one.
And then you see the branches, how it's branching out, right?
Yeah.
So the first branch of the celiac we said is what?
Hepatic artery.
The hepatic artery. Very good. Let me see if I can separate it. Remember the makeup, huh? Yeah, come on. Now, here we see the celiac trunk, right? Our first branch is going to be our hepatic. Then it's going to be our gastric. Here we see the splenic. The splenic. And you can almost follow it how it's going towards the spleen.
Right.
And it, the reason why it's going that way is because you lifted it that way?
Yeah, exactly.
It does the same thing on the other side?
Yeah, I just shift it up so we can see it better. Okay. Now, the next branch of the abdominal aorta, please.
Superior mesenteric.
Superior mesenteric artery. So here we encountered the superior mesenteric artery. What's it going to provide blood supply, please?
Small intestine and colon.
So if you follow its route, you notice how it's going towards those intestines. You see it? That's how you know that you're in your superior mesenteric artery, right? Celiac trunk, 1. Number 2, superior mesenteric. Now, the next branch, please.
Adrenal lumbar.
Now, this is my adrenal gland. You see this little portion here? It's very small, and it has a very small caliber artery that is called the adrenal lumbar. You see the vein clearly. You see here the vein? How it's going into the small gland?
Right.
The artery is here as also. You see how small it is? This little thing here.
Okay.
Now, the next branch, please.
Renal.
So by its name, you could tell that it's going where?
Kidney.
Exactly. So this is our kidneys, right? I'm going to separate all this adipose tissue, connected tissue that we see here, so we can see better the blood vessels. Oh yeah, thank you. Just to dry it up. Now, if you notice, here we see the vein, right? And here we see clearly the artery. You see? Each artery has a satellite vein that accompanies. So if you're not sure, just because the vein, you can see it better, immediately you see a vein, you know that an artery should be around it, right? So this is my renal artery and renal vein. Okay? Please continue.
Genital.
Renal meaning going to the kidneys, right?
Yes. Now, in those genitals or gonadals, right? If it's a female, as we have here, right? It's going to be called ovarian, and we can follow it. You see how it's going towards the ovary? You see it? If it's a male, we call it spermatic. You see? This is my ovarian artery. Continue, please.
Okay. Inferior mesenteric.
Okay. So remember, in the inferior mesenteric are going to provide blood to whom?
Colon.
Colon. So isn't this our colon? Yes? You see it? So look how this artery is attached to it. So this is going to be my inferior mesenteric artery. You see it? Yeah? Proceed, please.
Iliolumbar.
Now, if we continue our journey in the arteries, we're going to encounter all this that you see here. You see this big blood vessel? All that is the abdominal aorta. You see it? Towards the side here, we'll notice that we're going to have these blood vessels branching from that abdominal aorta. You see it? These are my iliolumbar. So then this is going to be my left iliolumbar, and then this is going to be my right iliolumbar. What do they provide blood supply, please?
Body wall muscles.
So you also notice that here we have the artery and the satellite vein. You see it? Iliolumbar artery, iliolumbar vein. You see it? Now, let's go on, please. No.
Like femoral?
Oh, you have to read it.
External ilia?
Well, there's caudal and then there's femoral artery. And then the
Right and
saphenous.
left external.
Yeah, the first one, please.
Ilia.
Iliacs, right? So we notice that this abdominal aorta, it comes to a point that bifurcates, right? You notice how it forms like this V shape? So then when it does this bifurcation, we call it the external iliacs. So then this is going to be my right external iliac, you see it? And then this is going to be my left external iliac. Go on, please. External iliac.
Internal ilia.
And you notice that here, in the inside, we see these small caliber blood vessels. So then this is going to be my right internal iliac, and then this is going to be my left internal iliac. Go on, please.
Caudal.
And the caudal is hard to see because it has to be deep inside there, and they're very small. So they're going to be literally inside of it.
Deep femoral.
Now, you're going to continue to dissect into the leg.
Okay.
Because remember that, you see how I'm just following, right? Once you trace an imaginary line here, this is tracing the groin, okay? So once again, like that analogy that we said, like street names, the iliacs, when they're above the inguinal canal, right, they're called iliacs. Past this, then they call femoral, right? So you're going to continue your dissection, continuing separating with the probe, you see, until you find the rest of the arteries. Proceed.